This video is about the steps needed to lower your high blood pressure without any medication. Using these steps, the blood pressure of a 59-year-old male is reduced from 160 over 100 to 128 over 70, which is almost the normal blood pressure for that age. Blood pressure is not a traditional disease, but is often referred to as a lifestyle disease. It is the pressure that blood applies to its flowing vessels as the heart pumps the blood. In the US, the normal blood pressure for a healthy adult is considered 120 over 80. High blood pressure is mostly associated with old age and a sedentary lifestyle. As an individual ages, plaque builds up in the arteries, which exerts more pressure on the arteries. Reducing blood pressure without medication requires a conscious, determined, and regular effort. Otherwise, it is a waste of time. I am neither a doctor nor a physician, so you have to take this with a pinch of salt. But wait, you can't take salt that liberally. That is the first change you need to take. Reduce salt intake. Here is a list of 10 lifestyle changes to reduce your hypertension without medication. The first step to reducing your blood pressure is to reduce salt intake. Common salt, which is also known as sodium chloride, is about 40% sodium and 60% chloride. Sodium is an essential nutrient necessary for the maintenance of plasma volume, acid-base balance, transmission of nerve impulses, maintenance of proper balance of water and minerals, and normal cell function. A healthy adult needs about 500 milligrams of sodium daily for these vital functions. However, an average American consumes about 3,300 milligrams of sodium per day, about 75% of which comes from processed foods. With high sodium in the blood, the kidneys have trouble keeping up with excess sodium. As sodium accumulates, the body holds onto water to dilute the sodium. This increases both the amount of fluid surrounding cells and the volume of blood in the bloodstream. Increased blood volume means more work for the heart and more pressure on blood vessels. Over time, the extra work and pressure can stiffen blood vessels, leading to high blood pressure, heart attack, and stroke. It can also lead to heart failure. Too much sodium in the blood causes a condition called hypernatremia. On the other hand, too little sodium in the blood causes hyponatremia, that is, sodium deficiency, which causes an altered mental state of confusion, lethargy, seizures, and in the worst case, coma. Almost all processed food has a high amount of salt as a preservative to increase shell life and improve the taste. For these reasons, some doctors have an extreme view of naming salt and sugar as toxins. So, avoiding or reducing processed food is the starting point of reducing blood pressure. However, never stop taking salt altogether to reduce hypertension, which will cause hyponatremia, which would result in a mental state of confusion and maybe coma. In short, there should be a temperance in salt intake. Try to have your daily requirements through your homemade diet and not through processed or fast food. Here is a sample sodium of chloride levels of a 59-year-old male. Both sodium and chloride is slightly above the minimum needed. This shows that there is no need to reduce sodium anymore. The second step is to increase potassium intake. Potassium in the human body works more or less as the opposite to sodium. Potassium balances pH, that is the acidity and alkalinity of the body, maintains blood pressure, controls muscle contractions, and maintains blood pressure. The best way to get your potassium is through your diet. However, processed and fast foods are high in sodium and low in potassium. By making homemade foods, you can lower the sodium intake and increase the potassium intake. The DASH diet, or dietary approaches to stop hypertension, which is high in potassium prescribed by physicians, helps to treat high blood pressure. Potassium-rich foods include fruits like avocado, banana, and pomegranate, dry fruits like raisins and dates, most vegetables, and leafy greens. Among leafy greens, beetroot leaves has the highest potassium content. Another advantage of potassium rich foods is that they are also low in glycemic index and thus help blood sugar to remain low. Potassium deficiency or low potassium in the body, called hypokalemia, causes fatigue, abnormal heartbeat, muscle cramps, high blood pressure, etc. The recommended potassium intake for men is 3,400 milligrams and 2,600 milligrams for women. Potassium helps the kidneys to get rid of excess sodium in the blood through urine. In case of potassium deficiency in the body, kidneys reabsorb sodium back into the body, resulting in high blood pressure. Always try to control your potassium levels in the body through diets such as DASH, as mentioned earlier. Taking too many potassium supplements may result in hyperkalemia, which can cause heart arrhythmia and other heart related conditions that can be fatal. Here is a sample potassium level of a 59-year-old male. This shows that there is still room for improvement from 4.6 to 5.6. The third step to decreasing your blood pressure is to increase your intake of magnesium. Magnesium deficiency is referred to as hypomagnesemia, which is defined as a serum magnesium level that is less than 0.75 millimoles per liter. Hypermagnesemia, on the other hand, occurs when there is excess magnesium in the body, which is greater than 1.05 millimoles per liter. The recommendation for adults is 420 milligrams for men and 320 milligrams for women per day. Magnesium rich food includes pumpkin seeds, chia seeds, almonds, etc. Magnesium also plays a role in the active transport of calcium and potassium ions across cell membranes. So, hypomagnesemia may also cause hypocalcemia or hypokalemia, which are low serum calcium or potassium levels, respectively. Another way to lower your blood pressure is to have healthy nitrate rich food. Nitrates in food come in healthy and unhealthy forms. Healthy nitrates come from vegetables like beetroot, green leafy vegetables, radishes, etc., while unhealthy nitrates come from processed food such as cold cuts, bologna, etc. Even your local groundwater supply can contain unhealthy nitrates. Nitrates are converted into nitrite in the blood, which dilates the blood vessels in a process called vasodilation, thus bringing down the blood pressure. This is the same way laughing gas, also known as nitrous oxide, works in the human body. It dilates blood vessels, which causes you to feel like laughing. Unhealthy nitrates cause cardiovascular diseases such as blue baby syndrome. And if you take beetroot juice from the beat of the size of your heart, which is approximately the size of your clenched fist, on alternate days for a couple of weeks, you will reduce your blood pressure. Note that beetroot has oxalates, which may create kidney stones if you are susceptible to it. Being well hydrated throughout the day, with at least 3 quarts of water a day, helps you to flush oxalates out of your body. Make sure you do not drink too much beetroot juice, which may bring down your blood pressure to a really low level. Another way to lower your blood pressure is to maintain a healthy dose of vitamin D in the body. There are two ways to increase vitamin D in the body: through diet or getting enough sunlight. Research and scientific literature suggests that vitamin D could play a role in the prevention and treatment of a number of different conditions, including type 1 and type 2 diabetes, hypertension, and multiple sclerosis. Vitamin D rich foods include fish, vitamin D fortified milk and juices, cereals, and mushrooms. An average person needs 600 IU every day. It is the UV rays or tanning rays in the sunlight that create vitamin D in the body. People with a darker skin tone have more melanin, which acts as a sunscreen. Thus, dark skinned people need more sun exposure. Unfortunately, many people avoid sun exposure for fear of getting tanned, which makes the situation worse and results in severe vitamin D deficiency. According to new research published in the Journal of the Endocrine Society, vitamin D supplementation can lower blood pressure in older and obese individuals. But the principle, the more the better, does not apply here. Exceeding the recommended doses of vitamin D does not provide additional health benefits. The sixth way of reducing your blood pressure is to avoid mental stress. Controlling every aspect of your emotions is very important. Whatever happens is going to happen whether you are tensed or at peace with yourself. An uncontrollable mind is one of the biggest culprits of blood pressure. According to the Roman philosopher Marcus Cicero, one of the six mistakes of man over the centuries is the tendency people have of worrying about things that they cannot change. So let your stubbornness go. Also, try your best to avoid procrastination. Make a conscious effort to control your mind through meditation, mindfulness, and practicing hobbies like painting, cooking, gardening, etc. Another easy way to reduce your blood pressure is through exercise. A sedentary lifestyle is the main culprit behind lifestyle diseases such as hypertension, diabetes, and high cholesterol. Simple changes in your lifestyle, such as walking in the sun after lunch, taking the stairs instead of the elevator, and any physical activity, needs a conscious effort. There are three types of exercises that can help you reduce hypertension. The first one is cardiovascular exercises, like running and jogging, which also shed salt through sweat. However, sweat sheds bad as well as good salt from the body. The second type of exercise is isometric exercise, such as wall squats and planks. And the third type of exercise is stretching, which relaxes muscles and improves blood flow, thus reducing blood pressure. Yoga and Tai Chi are good examples of this. According to a large study published in the British Journal of Sports Medicine, exercises that engage muscles without movement, such as wall squats and planks, may be the best for lowering blood pressure. This type of training is known as isometric or static exercise. Planking, along with wall squats, are more effective in lowering blood pressure in people with hypertension than any other type of exercise, as evidenced by an analysis of 270 clinical trials. Another major culprit of high blood pressure is smoking and alcohol consumption. So it would be advisable to quit smoking and drinking liquor in moderation or stop altogether. Keep yourself well hydrated throughout the day, and make sure you do not drink too much water in a short period of time, which may cause hyponatremia, which would result in too little sodium in your blood. Make sure you do not drink more than 1 liter of water per hour. A lack of sleep or irregular sleep patterns are also a common cause of hypertension. An adult needs at least 7 to 9 hours of sleep. Dr. Andrew Wales' deep relaxation breathing is a way of relaxation and an easy way to get sleep. Dr. Wales' 4-7-8 method of relaxation can help you fall asleep quickly. This consists of 4 count inhaling through the nose, 7 second holding the breath, and an 8 second exhale. Practice this method 10 to 20 times or 5 minutes before going to sleep in the night and just before getting up in the morning. Thus, 2 times a day and if possible, one more time during the afternoon. Those who practice yoga can try the pranayama breathing. Whatever you choose, you need to repeat this on a routine basis. When you take a deep breath, clear your mind and concentrate on your breathing or positive thoughts and pictures. If you have an enlarged spleen, known as splenomegaly, you may get pain when you take deep breaths, so be careful. The last and final way to make sure that you do not have hypertension or a high blood pressure is to ensure that you go for your annual physical. Most people find out that they have hypertension during a doctor's visit or annual physical. The main reason is that hypertension does not show any obvious symptoms. This annual physical is very important for every adult. If you find out that you have hypertension, do a blood test to check whether your sodium, potassium, magnesium, and vitamin D levels are normal. Once you start medication for blood pressure, you most likely need to continue for the rest of your life. So you may try the above mentioned steps for a couple of months to see whether you can bring your blood pressure back to normal before starting any medication on the advice of the doctors. Before I end this video, I would like to reiterate a couple of points. I would like to start by reminding you all that I am neither a physician nor a doctor. The information that I gathered here is after talking to individuals and doing my research. Anything that I mentioned here must be done after consulting your personal physician, including when you decide to start an exercise regime. I would also like to remind you all that everything should be done in moderation. Do not perform any sudden changes in your exercise pattern. Once your blood pressure goes down, you might be tempted to go back to your old habits. For most people, once their blood pressure goes down, they tend to go back to their old habits, which in turn will increase your blood pressure. So you must stick to your dietary exercise and relaxation regime. Finally, it is important to remember that small improvements in daily routine will add up over time. For example, if you make dough for bread or tortillas, use coconut water instead of water, because coconut water has a high potassium level. Whatever you do to reduce your hypertension indirectly improves your blood sugar, cholesterol, and cancer fighting capabilities. Carotenoids and beta carotene in carrots, anthocyanins in red radish, betalains in beetroot, terpenoids, lycopene, flavonoids, gallic acid, etc., all contain antioxidants that inhibit the action of carcinogens and prevent cancer. And this brings an end to my video today. I would like to thank you all for watching, and I hope you have a great day.